Hello, everybody. Angelica Olea here, Senior Vice President of Operations with Assisted Living Locators. Thanks for joining the All About Alzheimer's live stream with us today. This is created to provide families, caregivers, and professionals with practical advice, insights, and real-time answers to your questions about Alzheimer's and dementia care. Today's episode is Financial Planning for Alzheimer's and Dementia Care, Navigating the Cost and Resources. This is to help seniors and families make informed decisions while focusing on financial preparation, resources, and your options. I would love to encourage our viewers that are joining us today that if you have questions, please be sure to ask away. We are moderating this on YouTube, Facebook, and LinkedIn. And at the end of our live stream, we will be going over those questions. I would like to introduce our guests today, and if they would briefly share some information about themselves and where they are located. Brian Sullivan, thank you so much for joining us today. If you could tell everybody where you're from and why Alzheimer's and dementia care is so meaningful to you.
Sure. Hey, Angelica. Brian Sullivan, as you said, I'm in Metro Atlanta. I'm a senior living advisor here. I'm also a dementia care certified professional. I've been actively involved in this senior community for decades through service and volunteer opportunities, and only really just became full-time with this when I retired from banking in 2024. So I'm a now full-time dedicated resource to helping families find the best care communities for their seniors' needs.
Thank you so much, Brian. And I don't know if you mentioned you were in Atlanta, Georgia, for those that are joining us today.
Yep.
Thank you. And Bo Herman, if you would please introduce yourself and tell us where you're from and why Alzheimer's and dementia care is so meaningful to you.
Hi, my name is Bo Herman. I'm a certified senior advisor. I'm in the Orlando, Florida area. I'm also a certified dementia professional as well. For me, Alzheimer's is important because it's touched me personally with my family, but also I work with families on a daily basis who are impacted by Alzheimer's. I see the devastation that the disease brings. I have to work with the families as they're going through the journey. Everyone's journey is different, so I just try to help make the journey as painless and easy as possible.
Thank you so much, Bo. All right, well, let's dive right in. So our first topic is going to be understanding the financial impact of Alzheimer's and dementia. So I'd like to welcome Brian to come and talk to us a little bit. Brian, how can families and caregivers understand some of the cost associated, and what do people need to know?
Well, first, I think it's important to recognize that many people with dementia and Alzheimer's can live in either their home or in structured care communities throughout their lives, and they'll do pretty well there. So families need to be prepared in advance for either choice once they find themselves in that position. Making a decision early on about which care support model is very important. As we're aware, everything is more expensive these days, and senior care is not exempt from that in any way. So caring for seniors with dementia and Alzheimer's is going to take additional resources, both financial and from people as well. So, really, the cost has many dependencies. It's going to depend on individuals, the kind of care they need. Many times it boils down to, honestly, the diagnosis on where they are and what stage they're at, because that will dictate the kind of care they need. Now, that care could be, with just, again, being cared for at home, or it can be in a care community, but it will also be based on behaviors. So, and behaviors are, is that individual a risk to themselves and others? Or, do they require additional security and caregiving that will just keep them safe and happy and healthy going forward? So it's going to be dependent, that care, what it's going to cost is going to be dependent on choices that the caregivers and the seniors themselves make at an earlier time. So planning ahead is really critical. So really what it's going to cost, I will be honest with you, it's going to depend across the country, but at-home care will start at $25 per hour and go higher based on specialized skill needs. So when you start to add the number of hours per week and month, You can quickly see how that would escalate. Likewise, if you go into a care community, you're going to be talking about thousands of dollars per month to support them in a care community like an assisted living or a memory care community. So again, families need to be prepared for that in advance, thinking about these things and making decisions about how they'll support them financially.
Thank you so much, Brian. And as we go further into this live stream, that's one of the topics we'll touch on is why is it so important to plan for that? And I love that you touched on that because a lot of people aren't planning for this. So
Right.
so it's really critical that that's something that they think about. Bo, are you able to talk to us about additional factors that are influencing this cost of care?
Yeah, so and I like that's a great question, right? So when I talk to my clients, when I get a client, it's always kind of confusing. What are the costs for assisted living or memory care communities, right? So I always like to say that we have two different buckets here, right? The two different parts of the pie. The largest part of the pie is what we call the room and board cost. So this is the room rent, 3 meals a day, electricity, water, transportation, activities, laundry, housekeeping, right? So, according to Genworth in the Central Florida area, the room and board cost in memory care is around $4,500 a month. Now, the smaller component of the pie is what we call level of care cost. So, level of care is based upon the activities of daily living, right? And we have 6 of those, a couple more. And that's bathing, dressing, grooming, toileting, transfer assistance, eating assistance, medication management, right? So I always like to tell my clients that, think of it almost as a labor strategy. So the more help that somebody needs with these activities of daily living, the higher the level of care cost. So if you have to remind someone, hey, Sammy, don't forget it's time to take a shower today, right? That's a lot less time, a lot less labor than is as if a caregiver has to go out and actually get the items necessary for the shower if they have to do a shower standby. Right. So that means more labor, so higher level of care cost. So on average, that's around $1,000. Right. So if you put that together, that's where we get $5,500 a month. So that's where we have that cost. Right. That's where the care cost is. Some other factors are location. So a couple of years ago, I was featured in a Forbes article, and that was one of the questions they asked me. In the article, I just described that senior living cost is directly proportional to the cost of real estate. So if you're in a prime location, like a downtown metropolis area, you're going to pay a lot more for senior living than you would if you were to move outside, right? If you were to go out to the country or somewhere where there is, more tax advantages, unincorporated areas, you're going to pay a lot less. So that's another factor that goes into memory care cost. And then you also have duration of care. So that's one of the harder things when you're trying to decide, what the factors are of cost. We don't know how long somebody's going to be in a memory care community or assisted living. So, we can use our best judgment, but we can't see the future. On average, the average stay in assisted living is 22 months, but some people can far exceed it. We don't know. So, that's all things that we have to take into account when we're trying to, come up with a budget for determining how much we can spend when somebody goes into assisted living or memory care.
Thank you so much, Bo. And that pie chart, really being able to see that breakdown, I think is so helpful.
Right.
And to preface that as well is that that's the average for the Orlando area. And what
Right.
Bo was saying, Genworth is a great resource to go and kind of find out what your local average is in your own area. Because as you said too, it's kind of dependent on, are you in that metro area? Is it going to be more expensive in New York
Right.
City versus, a small town? So thank you so much, Bo. That was wonderful information.
Absolutely.
Our next topic is financial planning options and resources. So, Brian, what are some financial planning options and resources that are really important for our viewers to know?
Sure. So, I mean, there are a number out there. One of them that comes to mind is something that's called a health savings account. Now, health savings account is a tax advantage account that is usually associated with a qualified medical plan. So, I will caution that you do have to check with your carrier to ensure that the healthcare plan you're currently enrolled in does offer an HSA. So HSAs and something similar, also called a flex spending account or FSA, again, tax advantaged, and they can be used to pay for qualified medical expenses annually. Qualified medical expenses could be, the deductibles themselves, co-payments, prescription drugs, anything related to direct care that you will pay throughout the course of the year. Now, the one advantage health savings accounts have is that account can exist for years. So over time, if you are able to have an HSA, you will be able to accumulate wealth in that account that ultimately could help pay for some larger expenses later on, right? So we've talked about some numbers here that could be a little intimidating, right? Monthly rents of $5,500 and such. Health savings accounts would be a way to pay for those monthly charges later if you do incur them, and you would not have paid the taxes on what you contributed to those plans. So they are tax advantaged. They are fairly accessible, but you should check with your insurance carrier just to make sure that they do offer those, because they are, again, being tax advantaged, they are regulated by the federal government.
And so what about insurance options?
Yeah, so there are some policies that do exist. Insurance specifically, we're talking about life insurance and long-term care policies, not health insurance, surprisingly enough. So long-term care has always been underwritten as a life insurance policy. And that is basically, and many times it's a rider that's on your actual, payout in the cause of death. But long-term care policies are basically, should you need care at a certain age, and once you're diagnosed and meet certain conditions, those long-term care policies will provide you a stipend for either in-home care or to cover the cost of, a care community. So if you check your policies out there today, you may have a long-term care rider that could be a financial resource later on. You can also have long-term care policies that are underwritten individually or separately, and those are designed specifically for helping defray some of the costs for a monthly expenses with healthcare later on in life. I will tell you, not many insurance providers carry these policies any longer, simply because the cost of healthcare has escalated a lot in the past few months, and they're really difficult to underwrite. So finding one would be a challenge. Paying for one will probably also be a challenge, because you're going to pay some pretty high premiums. So again, it's structured like a life insurance policy, and you're going to pay out of pocket monthly for that, but you will be accumulating wealth and balance towards long-term care in the future. So definitely an option worth looking into, but I will say that your options are going to be few and far between. One other thing for caregivers is to talk to your parents. If they do have life insurance policies, it's really important to go back in and look at those policies, because first off, they may have long-term care riders on them already that may help defray some of those costs. But also those policies, you may be able to sell those policies or sell the beneficiary portion of that policy, which may generate cash on an immediate basis, which we're going to talk about again here in a few moments. But I just wanted to kind of lump that in with insurance policies and really stress the importance of knowing what insurance policies your family has in place, particularly your parents, when the time comes for their care.
Thank you, Brian. Yeah, and I want to touch on that insurance policies down here a little bit later in the live stream. Thank you so much. So let's talk about government programs. So some additional assistance and things that we like to clarify is the question we commonly get is Medicaid. What is Medicaid and what is Medicare? What other governmental programs can help pay for care? So Medicaid, Medicare, and VA aid and attendance benefits are some of those options that will provide financial assistance. And as we get a little bit later on, we'll talk about the difference of Medicaid versus Medicare. And we will also be sharing a free downloadable resource guide that you can find on our website. So assistedlivinglocators.com is where you'll find this. But Medicaid is state aid. So this is something that could potentially help qualify and pay for the assisted living side of it, while Medicare is going to be health care to really help pay for those. But if you're a veteran or widow of a veteran, there may be some additional funds that you could qualify for. So we will talk about these resources here shortly. I'd like to welcome Bo to talk about some other additional resources that will help pay for care.
Yeah, no, thank you, Angelica. So when I'm working with a client, right, we talked about the average is $5,500. So that's what my goal is, to see what resources are available so we can help them get to that $5,500 a month. So what the first thing we look at is their monthly income, right? So for most people, that's Social Security. Most people over the age of 67 receive some type of, Social Security pension from the government. They may have a private pension from a former employer, or they may have investments, right? Like an IRA, annuity, a 401k, right? So we kind of start there. Right. So what can we get from that? If they got 2,000, can we get some more from their other pensions and investments? For most Americans, the largest asset, the largest investment that they have is their home, right? Their homestead, their family house. So naturally, what we look to do is, if we can sell their house and to convert the proceeds from their sale of the house into an investment, right? Can we get 6-7% return on investment? Can we go to a financial planner? What will that give us, right? So that's usually another asset that we have to work with to try to get us that $5,500. And recently, I've been working with some clients. I know specifically from Central Florida, from the Orlando area, rental costs have really started to soar. So, that's another option that I'm presenting to my clients. The challenge is, when you sell your house, that's your largest asset, then you're drawing down upon the proceeds from the sale of your house, right? So you're always running the risk that you could run out of money, right? And that's not a situation anyone wants to be in. So what we look at is, well, maybe we have $3,500 a month that we have coming in from our Social Security, our pensions, investments. Can we get $2,000 a month from renting our house, right? So if we can do that, then it might make more sense to rent the house out. That way, we're not drawing down upon that asset. It's actually going to increase in value, right? So it's not a right fit for everyone, but it could be. Another option we have is reverse mortgage. A lot of times when people are in a situation where one spouse is going to remain at home, another spouse is going to go into a memory care community, it can get quite expensive, right? So you're both living off of that fixed income. What you can do is you can look at a reverse mortgage. So you can get some of the equity out of your house, where one person can remain in the house, and then use that reverse mortgage to help pay for memory care. Next is a life insurance settlement. So if you have a term or whole life, usually over $100,000, you can use that to help pay for it. Maybe it's a one lump sum, or you can break it down to monthly. Another option is a bridge loan. If you're going to sell your house, but you're going to need 30, 60 days, you can use this bridge loan to help cover some of your costs so you can move in faster and the senior can get the care they need. And then the Medicaid long-term care that Angelica mentioned as well.
Thank you, Bo. And we are just scratching the surface on this topic. We could spend hours talking about all the different financial options, but this is a great, great thing to mention. Bo, how do viewers contact you? What is the best way to find out more?
Yeah, so if they want information about any of those resources, they can reach out to me. They can reach out to Brian. They can reach out to any of their local senior care advisors. Most of us have professional partners that we've worked with, that our partners have have done a good job, and we recommend, because we know they provide the quality of care that our seniors and clients need.
Absolutely. Thank you so much, Bo.
Absolutely.
Brian, are you able to inform us what legal preparations should our families look at?
Yeah, so I can't stress enough the importance of really engaging with an estate planning attorney early on. Really, if you think about the potential scenario, right, a lot of people find themselves in a reactive situation, like mom or dad's had a fall, and suddenly they're having to step in and take care of folks. A little bit of prevention goes a long way, as we've all heard our seniors tell us over the years, right? So really, engaging with an estate planning lawyer is going to enable you to understand what resources are available, how to structure your resources, and how to structure care for the individuals going forward. So they'll recommend putting a will in place, advanced directives for their healthcare, and most importantly, powers of attorney, both general and healthcare. And that will help folks understand, hey, if a situation does come where someone's incapacitated, someone else can step in and start making decisions, right? But also having direction and clear understanding of what the individual wants for their care is imperative, because things, if they go into the courts, probate, et cetera, it's going to take a long time and care could suffer. So I would just stress, contact a senior living advisor like myself or Bo. Again, we're well networked with estate planning attorneys and other caregivers, and we can be an access point for you to find those resources you need that will help you start planning for what is likely an eventuality for a lot of people.
Thank you, Brian. And that ties perfectly into our next topic, which is common financial challenges and solutions. So we know that this is a big pain point for a lot of families. So, Bo, how do we handle this stress? What
Yeah,
are some?
so I've got 4 quick points for that. Understand the cost and plan ahead. So, look at some of the information that we've already provided. You kind of have a better understanding of what those costs are. You want to start preparing for that. If you have a senior, if you're working with your parents, try to get as much of that information as possible. Get in there and see what their Social Security is, see what their assets they are. Sometimes they don't like to share that information, but that's your job as their advocate to get a better understanding. So you could understand the cost, plan ahead. Utilize the insurance and benefits. If they are eligible for the VA aid and attendance, if they are eligible for Medicaid, go ahead and use it, right? It doesn't make sense to say, well, I don't want that. I'm too proud to use Medicaid. No, if it's there, if it's a resource that's available, then go ahead and use it, right? Don't stress out about that monthly payment when you have resources available. Explore care options, right? So, is it staying at home? If staying at home is less expensive than going to a community, right? We're at that $5,500. We're just using that as a target. If it makes more sense to stay at home because it's less expensive, do that. If it's assisted living or memory care makes more sense. And then engage legal and financial professionals. If you have an attorney, if you have a financial planner, then definitely talk to them before you make any decision, because they have your best interest and they've known you longer.
Thank you so much, Bo. And the common theme that I'm hearing through this is plan, plan, plan.
Absolutely.
You know,
Absolutely. It's better to have a plan and not use it than not have a plan and find out you need it later.
Absolutely. That contingency plan is critical.
Absolutely.
Brian, what are some available financial resources and some assistance?
Well, I think about, it's such a large topic and there are so many aspects of it. When I do think about, that there are 2 options, right? Number one, the Alzheimer's Association is a national network of care and support information, right? They have all sorts of information at the ready. By contacting the Alzheimer's Association, you can also plug into, specifics on the care you're going to need. So they have chapters all over the country. They're extremely well run, and they have really the best interests of everyone at heart by providing programs, events, resources and stuff. So I would definitely plug into the Alzheimer's Association for financial resources and legal if you so choose. The other option, which honestly goes unnoticed sometimes, is look at your local governments. They usually have a council on aging that is much more locally focused and will bring local resources to the picture that you may be able to access with just a quick phone call or driving down the street. So again, councils on aging within your local governments are a really great resource because they're focused on the particular needs of a region, and they may have some very specific options and things that you can access quickly.
Thank you, Brian. Well, I would love to jump to our live Q&A session. We've got some viewers that have submitted questions. And if you haven't submitted questions, here is your final chance. So be sure to submit those pretty quick here on YouTube, Facebook, or LinkedIn. So first question I'm going to ask is for Brian. Melody in Boston says, what is the best way to obtain power of attorney or guardianship when your loved one is incapacitated without getting conservatorship? How do I gain access to the bank accounts, insurance, and medical records, etc.?
Yeah, so again, going back to our earlier point, planning is everything here. In the event that there isn't a great plan in place or you're unsure, reach out to an estate planning attorney right away, because they will help you assess what needs are on an immediate basis and how you achieve the tools that you'll need to be able to step in and manage those affairs. That's really the key piece here. So definitely a planning attorney in your state, because state laws are different and you need somebody who understands how to navigate that, and also the court system, because if you don't have some of those tools in place, it may go to probate, and you'll need somebody who understands the court system and how to best to navigate that. So that would be my top recommendation there.
Thank you, Brian. And Bo, question for you that we received is, are you able to explain the Medicaid spend down?
Yep. So every state is different, right? So, I'm in Florida, South Carolina, Georgia, California, everyone has different options. So all states have some type of cap on how the assets that a person has available in order for them to qualify for their particular state's Medicaid program. So I can speak to what Florida is. There's two criteria. There's an overall asset that's about, that's they can't have more than $2,000 in total assets for if they're by themselves, and they can't have more than $2,800 in monthly income, right? So if they have more than that, then they have to spend that down. Now they can work with an estate planner. They can create a trust that can help them with that. Again, every situation is different. I'm not a legal professional, so I can't tell them exactly how to do that, but I would advise them to speak to an elder care attorney or estate planner to best meet their situation and needs.
Thank you so much, Bo. And thank you for that user that submitted that on YouTube. I would like to finalize this live stream and just thank you, Bo and Brian, for joining us today. Great topic that we're talking about. And like I said, this is just the surface of this. We could talk about it all day, but really the key points to summarize is plan, and be sure that it doesn't have to be just straight into Alzheimer's or dementia care. You can progress into that to save some money along the line. But I'd like to thank you, Brian and Bo. And Brian, if you could let viewers know how to reach you.
Sure. Literally, you can email me at bsullivan@assistedlivinglocators.com.
Awesome. And Bo, what about you? How do viewers get a hold of you?
Yeah, my email address is Bo, BEAUH for Herman, at assistedlivinglocators.com, locators with an S.
Thank you so much. And we will be sharing those in the comment section on YouTube, Facebook, and LinkedIn. And for those that joined us today on our live stream, thank you so much for joining and viewing this today. And if you want to view future live streams, please be sure to register at assistedlivinglocators.com. We will also drop that in the comments section of each platform. You can view this live stream and playback on our website, assistedlivinglocators.com, or on any of our social accounts on Facebook, YouTube, or LinkedIn. Thank you again for joining us today on All About Alzheimer's for financial planning and Alzheimer's and dementia care. Thank you and have a great rest of your day.